Okay, so I'm going to go in and meet Paul. Here we go. Paul.
Is there a way you can clip the door so that someone can't come in?
Oh, if they come in, that's fine. That's Dr. Paul in the distance there. Paul, how are you? How you feeling?
Moving on.
Getting okay? So we're at Dr. Paul's new abode. And we're going to train him in the facilities here to show you guys that there's no end to the training, as we know.
That's true.
Do
Do you need any background?
Well, yeah. Well, as we go, we'll definitely talk about your background for sure.
No, I mean, why am I in?
Absolutely, you
here?
can say anything you want. But before you do, Paul, so what we've done is Paul and I have been training for probably between 10 and 15 years, or it feels like centuries, and we're no longer in the gym. And I just wanted to record Dr. Paul still moving and still training and still up and about, because I think for guys out there, it's really important to keep moving no matter at what stage you are in your life. And Paul's in an interesting stage in his life, and he can tell you what's happening to him and what's led us to be here today.
Well, I turned 80 just a few weeks ago, which is not a bad innings. But along the way, about 8 months ago, I developed a lymphoma. And that had about 8 months of chemotherapy, which really rocked me about a lot. But I got through it. I'm now just on a 5 monthly infusion of rituximab. Rub that off your tongue, which is a monoclonal antibody, and it's keeping me well. I've got no sign of any future, any recurrence or anything like that. Now, fingers crossed, you can't guarantee that, but I'm feeling well. But Sue and I have got to an age of 80 where we figure, well, we have to have some upheaval in our life. So we've gone into this place, Calvary, sort of respite, sort of just take it easy.
Yeah, for both of you, which is good. And Paul's been given some exercises to do from various physios, because we've been training him recently at the gym before he came here, and his legs you're in so much pain just doing the slightest bit of movement. So the aim is to keep moving no matter what the situation, because movement is medicine, and it's easy for me to say from this side, and it's easy for a trainer to say to any client at any age, come on, get up and move. But it's really important to keep moving, specifically now for Paul and a lot of guys out there. But it's easy to say, it's hard to do.
And you lose conditions so quickly.
You lose what, Paul?
Conditions so quickly.
Yeah.
The best or worst of the exercises Jack gave me was the stand from sitting. You sit there like that, and then you stand up. And you do that.
Whilst you're there, you might as well keep going, Paul. Keep going. Lean forward a bit more, Paul.
And you do that about 10 times, maybe twice a day.
So let's keep going, Paul. We've just started. And Paul's hat, we're recording this around December time, is it's a very Jewish hat you're wearing today, Paul, in a very Christian way. He's got the Christmas celebration hat on.
I have a mantra that I use at this time of year that I always pass on. Roses are red, violets are bluish. If it wasn't for Christmas, it'd all still be Jewish.
Yes, correct. So let's keep going, Paul. So if you're going to follow along with Paul's exercise, you'll find, if you stand up again, Paul, he loses balance. I'll try to get that zoom back in. You'll notice he loses balance as he does it. Can you do it again, Paul? So now he's starting to recover that balance by putting his hands forward. So if you're having trouble sitting down or standing up out of your chair, especially a soft chair like this, keep going, Paul.
It takes a little while to get used to this particular exercise because it puts all the strain on the thighs.
Which is what we want. But you'll notice how he has to lean forward to do it.
Yeah.
You've got to lean forward. Just one more, Paul. Lean forward over the centre of balance, centre of gravity there.
I've done my exercises today.
No, I've come in to train you to do this. See how clients talk back no matter what age or what they're doing, even that Paul just did a set of 5 there, and he's feeling like, a 20-year-old would have done a set of 15. Mm-hmm. It's important to get that feeling just then, but it's great that no matter what age, clients talk back. and no matter what age of the client you're training or working with, a good trainer completely ignores it.
Absolutely, absolutely. I mean, Jack and I have been telling each other bad jokes for many years, but we've just gradually
Got worse.
moved it along.
So I reckon if you're at Paul's age in your vintage of your life, if you can grab that with both hands, Paul, can you lean forward a little bit? So this is an exercise that most of you will be able to do. It's going to get Paul to lift that above his head as high as he can. I know a lot of you are going to have frozen shoulders. There's not many 20-year-old athletes who've got frozen shoulders, but there's a lot of 80-year-old athletes who've got frozen shoulders. So as much as you can lift that walking stick, or if you haven't got access to a walking stick, you could possibly use your friend's walking stick, or just grab something from anywhere in the hospital bed if you are in hospital or at home. Yeah. 2 empty bottles of water you could do with.
This particular one, I don't think is as much about strength as keeping up mobility and range of movement.
Yeah.
And I've had one shoulder replacement, and my other shoulder's got fairly stuffed.
So rewind what you just said, Paul. You've had a shoulder replacement?
I had a shoulder replacement quite some time ago now.
Yeah.
But what that does, it helps me force maintenance of range of movement.
Yeah, which is really good. It's really good for mobility. And what tends to happen as you age is you'll find, not under doctor's orders, but the patient will find they're not putting things in the top shelf anymore of the kitchen, and so they don't have to reach up because it's better, and they just keep putting it further and further down, and of course they don't do this again. And another thing with that, I imagine, if you keep going, Paul, with that is, and Paul being a doctor, he's really good at correcting every bit of crap I've ever read in the industry. And one of the things I have read was the vertigo you suffer used to be called, I think, top shelf. Was it right? Top shelf vertigo. Yeah. Have you ever heard that saying before?
I have heard that saying.
So it was said by a doctor because you look up and then all of a sudden you lose a bit of balance, and you present yourself to a doctor and say, "Oh, I got sick. I looked up. I felt dizzy, and that's vertigo." And then they say it's called something else. What is it? It's a vestibular
ataxia.
I don't know. You're the doctor. How do I know what it is? Excuse me. I keep walking back and forth. I just want to check everything's in focus and in sight of the camera. So we're just trying to do between. No matter what age you are, what client is in front of me, I always work between lower body and upper body, and there's no science to it. It's just that it gives the upper body a rest, and we go back to lower body, and then we come back up to upper body. So Paul, if you could just stand up for me. And so this exercise I want Paul to do, if this gets in the camera, I'll just move the camera back, is just going to get you, I'm just going to zoom down to your toes, Paul. If you can, as much as you can, just come up on your toes and go back down, and stand up on your toes as high as you can. We're going to lose sight of Paul's head for a second. But we just want him to do, I imagine the physiotherapists out there would call this...
Can you hear all the people yelling at home saying, "Can you keep him out of the picture longer?"
Yeah, possibly. They want you out of the picture. They probably like this shot of you, Paul. But this is, there's a highly technical exercise. They'd call this heel raising, Paul, would you say?
Yes.
Yeah,
not hill raising, hill raising.
No. So if we can just keep up and hold up as high, keep up as long as you can. Now, if you've got a sore left leg, do your best to put most of the weight in the right leg as you come up and both legs as you go down. And vice versa, if you've got a sore right leg, come up with both legs and try to lower with your right leg, and the opposite of that. And Paul, once you've had enough of that, just sort of sit back down so you can get back in focus and just rest. So the resting, it doesn't matter what age you are. I've always said that resting is an active part of the workout. So you want to rest.
That's very Irish.
That's very, you can't say that anymore.
No, you're right.
You can't say very.
Oh.
No, you can't. I said to a guy this morning an Irish joke. I said, "Are you allowed to say Irish jokes?" And he said, "No, but I'm Irish, so you can." And I said, "That's interesting." He said, "If you're Irish, you can say Irish jokes." And I said, "Well, these are the laws of comedy." Excuse my rudeness. If you're Irish, you can say an Irish joke. If you're English, you can say an English joke. If you're gay, you can say a gay joke. If you're black, you can say a black joke. And if you're Jewish, you can say a Jewish joke. They're the laws of comedy telling. All right, so we know the laws. Okay, a pedophile walks into a pub.
Except, except
Boom, boom.
if you have a female client and you're male, you don't crack female jokes.
No, I'm assuming that's not. We're not here to be sexist or racist or Irish. But what we're going to do now, Paul, is hold that above your head again. So another mobility exercise. If you can put your hands slightly wider. If you haven't got a stick, you can just hold 2 pens up there and just bring the pens back to your shoulders and bring that stick back to your shoulders as much as you can, and just pushing it up. And just pushing it up. So we're just trying to increase the range and mobility, what Paul said before, of your upper body, and of course keep your strength of your lower body, because the lower body is going to lose strength, and the more you lose strength in your lower body, the more you're not going to want to get up out of your bed and get up out of your chair, wherever you're residing right now, whether it's a nursing home or at home, or a hospice place. Not hospice, what are you in? You're in respite.
Respite, yeah.
And then the moving part, when you do go out and you have to push buttons up above you, because if you're not in a place that's familiar to you, because this is new for you, isn't it? You know, there might be things in the shower that's higher than normal, and you just want to...
Yeah, and you think of those first 2 exercises. The first one is about strength and abs and whatever. The second one's much more about balance, just going up on the toes.
Yeah.
And it would be very, if I didn't really concentrate, I would have gone over backwards.
Yeah, and the falling, we're not going to do any more activity now, so you can sit back and just listen to Paul and I just chatting, and I think you probably enjoy that more than the training.
You do the work.
You can do the work, but do those exercises a couple of times a day, and then Paul and I are hopefully going to meet every week, and we're going to video our consultations, for want of a better word, and we're just going to chat and talk about life and stuff, but with balance. And it's great having Dr. Paul here, because he's got the medical knowledge and I've got the camera. So we can discuss things like what you just said, balance. Paul, my understanding is, when my mum was going through what Paul's going through now, about 20 years ago, if you fall over, correct me if I'm wrong, but 1 in 4 people who fall over will break their hip and be in a wheelchair for the rest of their life. Is that stat? Do you know, can you recall any of those stats?
The indications for doing hip replacements are getting softer and softer and softer.
What does that mean?
So it means it's not necessarily a life sentence of being, unable to use your hips.
So you're saying if you do fall over and break your hip, the hip replacement's better now?
They get better and better every few years.
So you're trying to... So what Paul's saying is we're encouraging you to fall over so you can have a hip replacement because they're better. Not quite.
Any orthopaedic surgeons watching the commission, please send a carer check.
So we don't really want people to fall over, but if they do fall over, it's better than my mum's period of living 20 years ago, which is good. That's a good thing, but we don't want people to fall over. So the more you can maintain your balance, the better it is. And those exercises will help that. And just on that, so I've trained multiple doctors out there, including Dr. Paul, and another doctor I said, this was about 20 years ago, he said, remember Dr. Barry?
Oh, yes.
And he said that medicine, the medical knowledge is used to be 10 years, then it was 5 years. Now, this is the lifespan of medical knowledge. And he said it's fast becoming 12 months. The stuff we knew 12 months ago is being superseded by the new stuff. And you're right, 20 years ago, the hip replacements were so different. So,
see, I left practice 2022.
Yep.
Within a year, I was having to, if I wanted to read up something, if I wanted to know something about something new, I had to read it up. Because even just in that relatively short time, my knowledge was waning.
Yep.
And the fact that your grandmother used to say you should do this is probably not good advice.
What do you mean?
Well, if your grandmother tells you do this, do this, do
Oh,
this.
okay. Yeah. Yeah, true. That's okay. You can't deny grandmothers.
The knowledge ages. You can still give her a kiss and say thanks for the advice.
Yeah. I had a doctor when I was young. I was 14, 15, had acne all over my face, and he said, put metho on my face. Methylated spirits. I said, really? He goes, it worked for me when I was a kid, so I'm not sure of that medical advice.
Some things are fairly universal, but there's
And obviously wrong.
and a lot of them, time has shown that they were wrong.
Yes.
And if you ignore that message, you're just going to knock it.
Yeah, we're not going to... I don't think encouraging someone to move up and down out of a seat. You know, I remember my dad, he'd be like this in the chair and sometimes over a minute getting off the chair. And that's not a good way to live. You're getting up and off the chair, great, which is really good.
Yeah, I'd like it to be smoother.
Yeah.
That's probably the main exercise I'm working on now.
Yeah, and that's come about from your recent, what would you say, your recent episodes of ill health.
When I had the lymphoma, I developed, wait for it, axonal neuropathy. That is the very big nerves in the legs were being affected, and so they got quite weak. So I'm really working reasonably hard now. I mean, I'm not that good a patient. To try and get that soreness out of the quads and be able to get more activity, more force out of them. And you just do it in bits. I mean, there's only 6 exercises on that. Jack will probably be horrified there should be 20. But those 6 are enough for a start. And I do them, if I can, twice a day, and usually at least 2 sets of each. Now, I won't say that's, I don't want to sound like I'm a goody-goody two-shoes. It's not every day, but I try and get it in as many days as I can now, and just get more tone in the muscles that lost the tone, partly as a result of that funny condition, the axonal neuropathy, and also just because I wasn't doing any exercise for quite a long time.
Yeah, but that wasn't any fault of your own, which is unfortunate.
Absolutely.
It's unfortunate because Paul, just so you know, Dr. Paul was trained with us at the studio here down under. Oh, I reckon you were training at least 4 to 5 days a week with us,
Yes.
with myself and another trainer and myself. And we were doing hour-long sessions, and he was training quite hard with heavy weights and stuff. And it wasn't until his recent health condition that it stopped us, or stopped you training, which has allowed me to go for longer lunches, which is really good. So we're going to meet up every week, Paul, and just train and help the people out there, guys like yourself, and really encourage them to keep moving and keep going no matter what age, what you're feeling. Even if you just do that once and then start once and then tomorrow do it twice, and then if you can keep doing just that and just tune in and watch the videos, have some fun with Dr. Paul and I, and we'll just come back to you weekly with a bit of fun.
If there's some fine points of detail with some of these exercises, we'll just check it out with Jack.
Yeah.
But the principles are the same. Repeat.
Yeah, it's boring. Yeah, every day I'm saying to clients, repeat. And what you just said is really interesting, Paul, because we're hoping, I'm intending to put this on, or if you're watching this, it's already on the social media networky places. And so you've just said to reach out to me, but write the comments below the video, and then we'll respond. And if it's a medical question, Paul's knowledge of medicine is unbelievable. You would have had to have finished one of the best in your class. I don't doubt it at all. And it's just, the clients will come in and I'll say, I've got Dr. Paul coming in next. I'll ask him. You used to be the ABC doctor for 28 years. Am I right or wrong? Right. Yeah. So I'm right, Paul. Remember that. I'm right. For 28 years, he was Dr. Paul on the ABC. So here in Australia, we have the ABC network, and Dr. Paul was the doctor, and he's still the knowledge. And you were AMA president for a while, so so and you've still got most of that knowledge in your head. It doesn't go away, does it?
It's not a matter of trying to retain all the knowledge, because no one does. But providing you're aware of where the gaps are opening, you can send someone to another doctor who's up to date with that. But certainly keep thinking about what you're doing with your body.
Yeah, and the questions, if they get too heady, and like we said, the medical knowledge goes so fast, but if they're just general fitness questions like how many times shall I do it, or Paul, I did this and it hurt my knee, should I see a physio, things like just general questions, I think we could, between the two of us, I think we can answer those questions. And to make it more interesting for you, if you're asking us questions, we come back next week and say, hey, we had 5 questions this week, Paul, Dr. Paul, it'll make it a bit of a fun.
I've got a question for
Yeah.
you.
Okay.
Why am I wearing this silly hat?
Yeah. Right. Yeah. Hands are below.
We've come straight from the lunch to the Christmas party of the place that I'm in now in respite, and that's why I've got this little funny thing on my head.
Yeah.
It
Cool.
must look ridiculous.
Yep, but that's okay. We'll continue. We'll keep that in as a mode. We'll wear a silly hat each week. Anyway, we'll see you next week. Thanks so much for joining us.
Thank you.